Welcome to This Explainer. Today, we're uncovering 5 hidden variables that could literally be sabotaging your high blood pressure treatment right under your nose. Look, if you've been prescribed amlodipine, you gotta know that just popping the pill, that's really only half the battle. We're gonna dive into the specific things that disrupt this medication and how you can easily sidestep them to get the absolute best results for your heart.
I mean, millions of people rely on this exact pill to lower their risk of heart attacks and strokes. But let's just ask a crucial question right out of the gate. Is your everyday routine unknowingly interfering with its effectiveness? Because certain foods, drinks, seemingly harmless over-the-counter meds, and even just basic daily habits can fundamentally change how your body reacts to this treatment.
To understand why, we've got to look at how the medication actually works. It's kind of fascinating. Amlodipine doesn't just magically lower some numbers on a screen. It physically relaxes and widens your blood vessels. It's exactly like taking a narrow, high-pressure garden hose and swapping it out for a wider pipe. It takes the pressure off, making it so much easier for your heart to pump blood. And understanding that widening effect? That is the key to seeing exactly why certain things we eat, drink, or do can completely throw a wrench in the works.
So, let's get right into Group 1, what you ingest. We're looking at some surprising diet and drug clashes.
And our first big surprise, grapefruit. Fun fact, researchers actually stumbled on this interaction entirely by accident back in the 80s. But what a lot of folks still don't realize today is that consuming large amounts of grapefruit, or even just grapefruit juice, heavily interferes with how your body processes amlodipine. It actually traps more of the drug in your bloodstream. So it's essentially making the medication dangerously stronger than your doctor ever intended.
And you will definitely feel that. Imagine standing up from your favorite comfortable chair, and suddenly the whole room is just spinning around you. That happens because a perfectly healthy fruit caused your blood pressure to plummet way too fast. You might get super lightheaded, get throbbing headaches, or even notice sudden swelling in your ankles and feet. Now, if you're a huge grapefruit fan, you might not have to banish it forever, but you absolutely have to talk to your doctor to see if any amount is actually safe for you.
All right, moving on to our second mistake. This is a super common but widely overlooked clash. You basically have a tug of war happening in your body. On one side, you're taking amlodipine to lower your blood pressure. But on the other side, frequent use of over-the-counter pain relievers, specifically stuff like ibuprofen or naproxen that you'd take for joint pain or arthritis, they can actively fight against your heart med. They can push your blood pressure right back up or just completely wreck the amlodipine's effectiveness. So before you grab that bottle of pain reliever off the pharmacy shelf, definitely run it by your doctor or pharmacist first.
Now, it's not just about what you swallow. Group 2 is all about how you live, specifically those dangerous daily lifestyle habits. Mistake number 3 is skipping doses or just taking them at completely random times throughout the week. And man, this is such a common trap. Why? Well, high blood pressure is notoriously called the silent killer for a reason. It has absolutely zero obvious symptoms. You can feel perfectly healthy, full of energy, totally fine, even when your blood pressure is sitting dangerously high. Because you don't feel sick, it is just incredibly easy to forget to take the pill.
But here's the catch. Amlodipine absolutely demands consistency. It works best when there's a steady, predictable amount of it in your system 24/7. Missing doses causes your blood pressure to literally bounce around like a yo-yo. To lock in that consistency, you've got to build a foolproof routine. Set a daily alarm on your phone, grab one of those simple pill organizers, or just anchor the habit to something you already do every single day without fail, like brushing your teeth.
Okay, let's do the dangerous math for mistake 4, which is combining excessive alcohol with your medication. Think about it. Alcohol, all on its own, lowers your blood pressure. Amlodipine, as we know, lowers your blood pressure. Combine the two and you get an extreme compounding drop. What a lot of people don't realize until it's too late is that this combo makes you incredibly dizzy, weak, and unsteady. Especially for older adults, this makes a totally normal thing, like getting out of bed for a quick bathroom trip in the middle of the night, incredibly risky because the chance of falling is just so high.
Which brings us to Group 3, the ultimate pitfall, the very real risk of stopping early.
So the fifth and final mistake is just stopping amlodipine completely without talking to your doctor. Folks usually do this for one of 2 reasons. Either they get a mild side effect and just throw their hands up and quit, or ironically, they check their blood pressure, see a perfectly normal reading, feel totally fine and think, hey, I'm cured. But they're forgetting the core logic here. Feeling normal and seeing normal numbers means the medicine is actually doing its exact job. It didn't cure the underlying condition, it's just actively managing it.
And the consequences of quitting are pretty stark.
If you just stop cold turkey on your own, you throw the front door wide open for your blood pressure to surge straight back up. And with that massive surge comes a sharply increased risk of a heart attack, a stroke, or long-term kidney disease. Look, if you're dealing with side effects, like maybe some swollen ankles or just feeling tired all the time, don't just quit. Talk to your doctor. They can easily tweak your dose or just find a much better suited alternative for your body.
So let's pivot away from the mistakes and talk about your heart health routine. This is your blueprint for success.
At the end of the day, protecting your heart isn't about making some massive impossible lifestyle overhauls overnight. It's about smart, consistent little choices. Here is your rapid-fire blueprint to follow. Watch out for large amounts of grapefruit. Always double-check those OTC pain relievers, like ibuprofen, with your doctor. Keep your medication levels steady by literally never skipping a dose. Limit that alcohol intake so you don't get that compounding dizziness. And finally, never ever stop taking your medication without your doctor giving you the explicit green light.
Managing high blood pressure is for sure a long-term journey, but every single smart, consistent decision you make actively protects your future and lets your medication do its life-saving work. So, as we wrap up this explainer, I want to leave you with one vital question to think about regarding your own routine. What healthy choice are you going to make for your heart today? Thanks so much for joining me as we unpacked all this. Stay healthy, stay consistent, and I will catch you next time.